It means by removing blood, what do? You are treating the patient. So what are some of the conditions that you need to do therapeutic phlebotomy? These are like hemochromatosis. Okay? That means this hemochromatosis means an increased level of iron in the blood. Okay, in the body. When you have an increased level of iron, it's called hemochromatosis. Another condition where you can do is polycythemia. Polycythemia is when there is an increase in the level of what?
Red blood.
In red blood cells, yes. It's the opposite of anemia, okay? Because anemia is what? Anemia is low red blood cell, yes? Polycythemia is the opposite, which is high or an increase. So that means if the patient has a high level of red blood cell, it's not good for the patient, yes? Okay, so you have to decrease that amount of red blood cell from the body. So you use what we call therapeutic phlebotomy. Another condition that you can use is what we call porphyria cutanea tarda, or it's called PCT. PCT, which is called porphyria cutanea tarda. It's a condition where it's a condition where the skin is being involved, especially when the skin is exposed to sunlight. And usually people with porphyria cutanea tarda, they have usually recurring blisters. That means that they have blisters or small swellings that contain like fluid, and they rupture. Okay, and what is the cause of this? Usually there is an increase in or a high level of what? Iron, and it's deposited on the kidney, on the liver. Okay, the high iron will be where? It will be deposited in the liver. So it leads to what? To liver damage. So an important thing for porphyria cutanea tarda, you have what? A liver problem, and you will have what? A skin lesion or a skin problem. That's because of accumulation of iron in the liver. So, if a patient has all these three conditions, then you can do a therapeutic phlebotomy. Okay, you can do therapeutic phlebotomy. So, what are the four major work duties of a phlebotomist? That means, okay, 1, okay, equipment, 2, procedure, 3, patient care, 4, records and patient information. So these are the 4 categories. Equipment means what? You have to make sure that the equipment that you are using are what? Sterile, they are not contaminated, okay, they are not expired. All these are your duties, and you have to make sure all your equipments are available, like gauze, okay, needle, a syringe, alcohol pads, tourniquets, all should be available. And procedure means you need to do what? A correct step of blood draw. So you remember we have all these 10 steps of blood draw, so you have to follow the proper what? Step of blood draw. It means you have to start from what? Identifying the patient, getting the requisition, okay, and then what? Check the name, if it is okay, the same as the requisition. Yeah. So identify the patient properly. You wash your hands, put on gloves, apply tourniquet, and then you start your procedure. So doing the correct procedure is called procedure. And then patient care means what? You try to alleviate like some pain. You don't need to harm a patient, okay? That means you don't need to hurt, okay? Anyways, that means phlebotomy is what? Venipuncture or any kind of blood draw is, it has pain, yes? So you have to tell the patient, but you should alleviate the pain of the patient. That means, yeah, how? By reassuring the patient. Okay, it's a fast and quick procedure. Usually it's less than a minute it will take, yes? So you have to tell them that. And after you do the draw, you have to take care of no bleeding, no allergic reactions, the patient shouldn't want fainting and so on. Okay, that is one. And patient information means you have to keep the confidential of the patient. Okay, it means it should be confidential. All information should be what? Confidential. And you have to document everything that you did. If you don't document, then no one knows that you did that test or that procedure. So these are what we call okay. And quality improvement methods. So quality improvement means every time you need to improve the quality of your care, your procedure. Yes? So you have to improve that. So how do you do that? Usually you can follow like some charts, what we call flow chart and a Pareto chart. Okay? You can use this and you try to improve the facility or it can be the cleanliness, the sterility. So everything should be improved from time to time. So it's called quality control. And you have to record some quality control things. So how do you follow quality control? One, check the expiration date of all the material that you have. That's one of quality control. Okay, for example, tubes. Okay, you have to check if it's expired or not. Needles, you have to check if it's expired or not. Strips, you have to check if it's expired or not. So that is one of the checking the quality control. So, okay, you have to follow that. And storage information, proper usage. Okay, test like supplies, reagents. Okay, they should be always what? Accurate, and they shouldn't be what? Like let's say you have ABO blood typing. If it's expired, urinalysis strips, so you have to check if it is what? Not expired. Another thing is if you have machines, they should be what? Properly calibrated. It's called calibration. Okay? So we finish on this and let's go to the next page, page 5. Now what we do will be, so each of us will read one chapter each, I mean one page each, and then you will get the famous 10 questions for that chapter. Now we are going to finish the chapter where we are remaining with 2 pages. So let's start from here. Okay. So Sagar will read page 5.
Work environment. Phlebotomy technician can work in a variety of medical settings, such as hospitals, clinics, doctor's office, laboratories, blood bank, research firm, and/or pharmaceutical firms, hospitals, institutions which provide medical and surgical treatment, clinic, institute or hospital department focusing on diagnosis and care of outpatients. Doctor's office, suit office, where doctors receive and treat patients. Laboratory, building or room where tests are performed to evaluate specimen in order to diagnose medical condition. Blood bank, an institution where blood is collecting from donor and then stored and prepared for transfusion. Research firm, an institution equipped for scientific medical research that may specialize in basic research or on specific areas. Pharmaceutical firm, an institution that develop and marks the drug as a medication, for use as a medication.
Okay. Any questions now from this? Any question? Okay. Now let's go to the next. Okay. So let's go to safety considerations. So can you read next and then?
Safety consideration. Phlebotomy technicians must be aware of the risks and dangers involved with specimen collection. Organizations such as the CDC have put the strict guidelines for healthcare professionals to follow to ensure their own safety, and therefore increase safety for patients and other workers. Universal precautions require that all use needles must be discarded intake. The purpose of infection control is to prevent the spreading of infection within a medical setting, such as a hospital. Although certain bodily materials such as feces, urine, and blood can be a potential source of infection. In a protective isolation setting, it is the phlebotomist who is the potential threat to the patient. Therefore, it is necessary to wear masks, gloves, and coat or gowns with the patient that are in protective isolation. If the patient developed infections while in the hospital that were not present before hospitalization, the infection is classified as nosocomial. The chain of infection usually includes the source, susceptible host, and poor isolation technique. Hygiene. Washing hands with soap and water if they are visible dirty. Good hand hygiene techniques reduce the number of outbreaks of infections. Hand washing is the single most important way to prevent spread of infection. Equipment: gloves, masks, goggles, and gowns or coat. Autoclaves: instruments for sterilizing under pressure. Emergency needle stick information: if exposed due to needle stick or other sharp object, wash